So I'm going to tell you about work we've been doing over the past few years where we're not trying to do the same thing that we used to do by hand, we now do with AI. So it's not about automating old stuff. We're trying to always look for innovation where we can do things with AI that we couldn't imagine to do by hand. And that has a whole range of implications for how we can manage our health. And the first realization you need to have is that, of course, data saves lives. And that's not a new realization, it's quite old. In fact, so old that this gentleman here, John Snow, over 150 years ago, had to battle the problems of cholera in a big city. In Germany, there was another guy, Rudolf Virchow, who had the same problem in Berlin. But John Snow was in London, and there was this epidemic, and they didn't know how cholera spread. People thought it was about bad air called miasma that spread the disease, and other people said, well, no, maybe it's some agent that is traveling in the water. So what John Snow did is he invented data science. So he literally took the chart of the London streets that you see there, and then had this radical idea of drawing a rectangle for every patient that was in a certain house at a certain address who had cholera. And the more patients there were in that house, the higher the bar became. And that was the invention of the bar chart. The next thing that he did is he realized, oh, look, if you look at the data, it seems that all these high bars are clustered around a certain area. And then he also did and looked at, well, what's in the center of that cluster? And in the center of that cluster was the Broad Street water pump that you see over there. And so he did what only in those days a healthcare official could do. He had it simply shut down. And with that causal intervention, he stopped new cases of cholera appearing and shut down the cholera epidemic. So that's the invention of data science and epidemiology and managing infectious diseases through a science-based evidence process, all in one go. So now we can ask ourselves, well, what has happened in the last 100+ years? So the first exciting thing is that we can start thinking now about using the latest technologies, generative AI, to model healthcare data, not just to predict stuff, but to do useful stuff. And so this is a study that we just finished conducting this year in the country of Wales. It's one of the 4 countries of the United Kingdom. And in Wales, we have all patients' healthcare data, all the GP records, all the hospital records. Every time you went to a pharmacy, we have all the data since 2009. And so what we did is we asked the question, well, can we use this data to help the healthcare system manage the demand on the healthcare system? Can we predict how patients are going? And the biggest challenge that you have when you do that is that you need to have a lot of data of patients, or at least that was the assumption. And colleagues in the US have done this by taking a blood test every week of a patient and saying, oh, we can now predict if he's doing better or worse. But can we do that within our context of a healthcare system where maybe you don't go for a few months to a doctor? And so we access the healthcare records, said we ignore all the data that is medical data, and we just look at the administrative data. So data that doesn't require a doctor to enter, data that is coming technically by a secretary. And we were able to build an AI system that looked at the temporal patterns with which people access the healthcare system. And that, and a few other numbers like how old you are, what gender you are, where you live, allowed us to build a system that predicts with over 80% accuracy, so 4 out of 5 cases, if you have to go unexpectedly to hospital in the next 3 months. That performance was so surprising that the public health authorities contacted us, okay, how can we use this to plan demand and manage, say, surgical requirements in hospitals? Hospitals contacted us and wanted to know, well, we need to know how many patients are coming in on that weekend. General practitioners contact us and say, well, can we use this technology now to, for example, prioritize patients who are on a waiting list and we should see earlier? And some patients wanted to know, can you tell us this if I need to go to a hospital? And all of a sudden, we had a technology that uses intelligence at scale. It's trained on 1 million patients, and we tested it on 2 different cohorts of another 1 million patients respectively, to really think about solutions in what we call digital public health at the scale of a nation state. And the interesting thing, once you start thinking at that scale, you realize there's healthcare data everywhere. And we're leaking and bleeding data every single day by just interacting with the world. So this is another project that we did, where we have collaborated with Tesco. It's a big supermarket chain in the UK. And they were actually the inventors of the first membership cards of a supermarket. So every time you shop, you scan your shopping. And so they have infinite amounts of shopping basket data. And we started to ask, well, when I meet a loved one, I can see that something is not right because something changes in their behavior. And so we wondered, does change in healthcare state change what you're shopping? And so we started a study with colleagues at the top hospital for cancer, that's the Royal Marsden Hospital in London, and we looked at women who were diagnosed with ovarian cancer. And we asked them, can we access your shopping baskets? And then basically we did what supermarkets have been doing for 20 years, but we had to reinvent it because everything is proprietary, so we invented this as an academic group, and developed machine learning methods to analyze shopping basket. And to our surprise, we detected a signal that told us whether a woman would develop ovarian cancer that was 8 months earlier detectable than the actual diagnosis they received from the hospital. Now, these are complex machine-learned patterns, so it's difficult to verbalize them. But I want to give you an intuition why the machine works. So first of all, ovarian cancer gives you bloating. So in England, we like baked beans, so out go the baked beans out of your menu. You stop buying, for example, cabbages and other things that give you bloating. And maybe you take, congestion relief tablets to help with the overall process that you can buy over the counter. And so this tells you now that there's a myriad of data out there that we can use to manage the healthcare state of a person and of a nation. So how can we take this further? So now that we can use and think about solutions that we couldn't envision before, we can, so to speak, observe patients better. We know how they are doing. The next step that is obvious is we need to start treating these patients, helping them. So that's what I call closing the treatment gap. A lot of AI is focused on diagnosis, mainly in hospitals where you get a lot of data and then you diagnose that. But once the diagnosis is there, the work of the doctor really starts. You need to treat patients. So here, over the many years, we developed a lot of technologies around what you call nowadays agentic AI systems that go out there and start affecting and treating patients. And when you develop these type of technologies, you very quickly realize that the regulation to deal with the system, as in our AI clinician case, that can treat semi-autonomously patients is not there yet. So we needed to invent ways of evaluating in the relevant context, and this is St. Mary's Hospital in London, how a human doctor interacts with an AI that makes a treatment recommendation, the recommendation for a precise dosing of a drug or putting that patient on a different drug. And what you're seeing here is just examples of this test bed that we've created over the years, where you see that we're doing eye tracking on the doctor, interacting with the patients, and we can exactly see what information they're processing. And I can tell you, it's not what you would have expected. So for example, people talk a lot about explainable AI. Well, doctors didn't care about the explainability. They just cared about the recommendation when they were interacting with the system. Just one of many interesting things. So now the question is, well, Aldo, you're showing us loads of little examples of individual crafted cases. So what's the next level? Well, the next level is that we need to combine these data at scale. So what we need is a foundation model that can process the most diverse sets of multimodal data, coming from a hospital, coming from a pharmacy, coming from a medical doctor, from your shopping records. And so on the 4th of March this year, we launched Nightingale AI, which is meant to be the first health foundation model. Nightingale is different from what you may have seen in the news, that there's a large language model that reasons about medical cases. That's a bit like getting a literature student, somebody who studied literature, read a medical research paper, and then you ask him intelligence questions about that. I want somebody who has the intuition of a medical doctor, not of somebody who reasons about text, but someone who reads about patients. And so these type of models read everything, X-ray, ECGs, whatever other information you have, and can then also make prediction across that scale. And so Nightingale was launched in March. By April 25, we had the first 100,000 patients worth of records, so that's well over 10 million records. We've just received a further 4 million patient records anonymized as a patient donation to help build this model. And I'm very delighted to say that now we have scaled up not just the data amount, but also the compute to really allow us to build systems at scale. So now we have access to a large supercomputer with 5,000 plus GPUs and have till the end of this year 1 million GPU hours to build our foundation model at scale. So why am I telling you this? I'm telling you this to inspire you, mainly, and prepare you for the exciting panel where it's really going to get interesting, that we can now think about managing health at the individual level, but also at a national scale to provide really what I call holistic health. Health that uses all data that's available and uses all intelligence that you have to optimize and personalize the treatment for you. And with that, I want to talk to you about what we can do together to use this unique opportunity that Europe has to make this happen. And for that, I'm delighted to have a panel of high-powered individuals that will support us. And while I'm going to introduce the panel, while they walk up, I'm going to play you a video how Isambard AI, that's the 11th largest supercomputer in the world, was constructed. In Isambard, the decision of the cabinet in the UK came in December 2023, and that's the frame shot of the assembly, all the way to the first day we were allowed to compute on it with Nightingale. So watch the video, and please welcome Ariel Doral-Stern, Nick Schneider, and Rainer Birkenbacher.